Almost 1 year since the pandemic in this country began, many of us have had to turn to virtual health care instead of in-person doctor visits. While this is convenient for some, it's also very challenging for various reasons. For older Americans especially, new technology can be intimidating, to say the least. My own parents, who are in their 70s and 80s, trying to help them with their health care when they haven't been able to physically go into a clinic and then see their doctor, that's been difficult on my end. And for our 65 and older viewers who have had trouble navigating vaccination appointments online, my next interview could possibly help. Anjali Kataria worked for the FDA under the Obama administration. Her husband is a former executive with Google, and together they've created something called Mytonomy. Anjali, I spoke a little bit about my parents, and they have struggles just like older Americans do. With technology, it can be really hard. This really interested you because of something with your own mom. Let's start there.
That's absolutely right, Betsy. Thank you so much for having me today. My mother got ill. She fell ill, and I suddenly became a caregiver. I was joining the Obama-Biden administration. I was coming on to the FDA as one of the first entrepreneurs and residents. And I was flying back and forth between Durham, North Carolina, and Washington, D.C. because my mother got sick, and I suddenly became a caregiver. And I realized when you get sick yourself or someone you love gets ill, and you're caring for them, it's a very difficult and very cumbersome process. And you're trying to learn all of this new information so quickly. And we just haven't given patients and their families the skills and the solutions that they need to care for themselves at home.
Okay, now, here's something I know doctors hate. When people go online, they Google whatever symptoms they might be having, and then they self-diagnose. So going online for patients has been very convenient, but for doctors trying to tell their patients, Google doesn't necessarily have your answers. So how does Mytonomy come in to kind of bridge maybe that gap?
That's exactly right. I mean, there's so much misinformation out there, and it's not just that doctors have consternation when they find out their patients have been Googling online, but the patients themselves really don't often get the right information. And you're making life and death decisions. You're making decisions that impact your future. And you want to know that you can trust that content. Mytonomy helps by creating an asynchronous virtual care platform where hospitals and providers can rely on the content. It's them. We're featuring your doctor, your hospital, and we're streaming that into the living room. So we're taking the power of streaming into a healthcare platform. I just think during COVID, how many of us all watched our favorite shows on Netflix or Amazon Prime or Hulu? 77% of us are streaming content every week. Why aren't we using that in healthcare? And so that's where Mytonomy comes in. We are bringing that streaming content, which are short form instructions on what you need to do to care for yourself at home, that's tailored and personalized. It's a data-driven model. And we're combining that streaming platform with an outreach platform like a customer relationship management solution like a Salesforce or HealthGrades or Microsoft Dynamics. These are big outreach solutions, marketing solutions that help us then learn what is it that you're viewing and how do you feel about what you just watched if you're in your living room.
Okay, so let's break this down even a little bit more for people who are maybe not tech savvy, our older 65 and up population, not necessarily tech savvy. I am, and as I listen to you, I'm like, this can still be confusing for people. So what I'm going to do is give you an example and then walk me through how Mytonomy helps me. So let's say that I've gone to the doctor, had a breast cancer diagnosis, had some treatments, in remission. And then what? How does Mytonomy help me in my situation?
So we would help you at the time you went in for your first biopsy, before you even knew what your diagnosis was. We would back it up and we would say, all right, you just got a worrisome finding and you need to go in for a biopsy. Let's share with you what that whole arc of that journey is going to look like. And what is a biopsy? Where are you going to go? What's going to happen in that biopsy? What are the possibilities of an abnormal biopsy in terms of treating that? You might have surgery, you might have radiation, you might have chemotherapy, you might have a combination of those, so that you are in the know at every step of the journey not just at the end, but at the very beginning. So we're giving you that consumer-like experience that we're used to, seeing what hotel we're going to go to, or what restaurant we're going to go to, or what that neighborhood looks like before we go and look at a new house or a condo we want to buy. So we're previewing with you what's about to happen so that you can start to learn the information. And then when you go in to meet your doctor, you're able to have a much deeper conversation about, should I have this surgery or should I have that treatment? Once you've had the surgery, once you've had the outcomes, we continue on with you. So that's why it's across that whole patient journey. You're met with short form videos, and you have a heart healthy nurse or a diabetes educator in your living room guiding you through what you need to do next. And it's all coming from your provider, from your healthcare system. So it's white labeled, it's branded to your hospital, and your hospital has approved all of the content. In fact, they're the main actors in the videos. That you're going to see your doctors and nurses talking to you in short form video.
Is this going to cost me? Because of course people want to know what's in it for you and how much is it going to cost me?
It's going to cost you zero, because this is something your healthcare system provides for you. Every healthcare system is challenged today by providing consistent care. Consistency is a big issue, and healthcare is so fragmented. There's so many gaps in care that we actually help hospitals and providers close those gaps and create a more consistent care experience. So they actually buy this on behalf of all their patients and just provide you with an account.
So I just need to ask my doctor if they have access to this, and then
You have Mytonomy.
yeah,
That's
but
right.
what if they don't?
They can get it. They can come to our website and set up a demo, and we're happy to support them.
Well, you know, we are in the land of healthcare here in Rochester, Minnesota, so I need to check into how many of our physicians and facilities here are actually doing this. But you know what? What we'll do, Anjali, is put a link to Mytonomy with this interview on our website so people can check it out and look into it and see if that's something that they can talk to their provider about. I appreciate your time. Thank you for the service that you provide as well. We'll be back.